Hello, everyone, and welcome back to the Healing Wellness Show, the podcast where we explore natural healing, science based wellness, and conversation that empowers you to take control of your health. I'm your host, Dr. Karim, sponsored by Iowa Wellness Center and Family and Sport Chiropractic, where we help people overcome chronic pain, neuropathy, spinal issues, knee problems, and much, much more. And today I'm really excited because we have a powerhouse expert joining us, Dr. Chris from Square One Health, a clinic nationally recognized for its advanced work with scoliosis, structural correction, functional neurology, and long-term spinal stabilization. So if you are someone or a loved one that has scoliosis, or if you've been told to wait and watch, or if you've been trying to avoid surgery, or even if you've been living in pain without real answers, this episode is going to change everything. So let's get started. Dr. Chris, I'd like to welcome you to the Healing Wellness Show. And just for our listeners out there who haven't met you yet or heard of you, why don't you tell us a little bit about your background and how Square One Health became a leader in scoliosis and structural correction?
Yeah, my background, I'm a chiropractor and I practice a technique called chiropractic biophysics right when I was out of school. And I've done that for about 18 years, but that led me into treating scoliosis patients. And now that's exclusively what I do. I actually have a scoliosis specialty clinic that I work in called ScoliCare. I still have the Square One Health, but I don't see patients in there anymore. But yeah, so that led me into developing a scoliosis specialty clinic that attracts patients both nationally and internationally. And we focus on doing custom bracing and scoliosis specific rehabilitation. And a lot of times we're working with other healthcare providers and co-managing patients with them.
So I'd like to always start with the person's why, like your story. Scoliosis. Why did you become an expert in scoliosis? Do you have a background story for that?
Yeah, I mean, it was something that I started doing little by little because I would get patients that had scoliosis and I had nowhere else to refer them to. But, it was really challenging and really difficult. And I got at one point where someone actually suggested, like, you should just focus on scoliosis. That's something you can probably do better than anyone else, or at least at an extreme high level. And I thought, this is actually, and these are patients that are very challenging. I didn't think at the time I would want to see patients at that level all day long, just dealing with scoliosis. But I kind of thought, maybe I just need to get better at it. And so I passed off everything else I did in my office to an associate doctor, and I just focused on treating scoliosis patients. And when I just did that, I got a lot better at it. It became more fun and rewarding, but I had patients that I had nowhere else I could send them. And so I think for me, it was just a higher purpose. And that led me to working with ScoliCare because then I could work directly with the world's leading experts. For me, it was just a higher purpose, treating patients that I really had nowhere else to send, for non-surgical treatment options.
So when talking about scoliosis, it's a word that people hear a lot, but
Mhm.
many don't really fully understand what it means. From your perspective, what is scoliosis and why does it develop?
Well, there's many potential different types or causes of scoliosis, but on a simple level, it's when the spine starts to twist or rotate. And for someone to be diagnosed with scoliosis, you need to have at least 10 degrees of lateral bending on an x-ray, and there must be rotation present. And the most common form of scoliosis, which is called idiopathic scoliosis, the one that typically gets diagnosed when kids are going through growth spurts, it's because the spine starts to grow asymmetrical. Some parts of the bone grow slower, some grow faster, and that causes the spine to start to twist and rotate.
So many patients will tell us, and I don't know if you get that their doctor will say, "Hey, let's just watch and wait," and then things typically get worse. So why does that happen?
I mean, that is what you hear a lot of times in the medical kind of field. And I think there's a couple of reasons why that happens. One, if I just look at like most people, if they go to a pediatrician or a primary care doctor, they're going to get referred to an orthopedic specialist. And in the orthopedic specialist, their conservative treatments, first, they're actually not real great at it, but they only offer treatments in a really narrow window. And when they do treatments, their only goal is to try and slow it down to the
Mm.
point where it's not surgical. If you look at children hospitals, videos or advertisements, they'll actually tell you that you cannot reduce the size of scoliosis in a growing teenager or child. You can only try to slow it down. And that may be true for their treatments, but internationally, there's a lot of evidence that shows, and we do it every day at ScoliCare, you can reduce curves in kids with the right treatment. The other thing is their scope of treatment is so narrow as far as which curves they will treat outside of surgery. But even now, some of the orthopedic centers are really evaluating their own treatment guidelines and saying we should probably start treating these curves when they're smaller and even treat them when they're larger before surgery. Because right now, they only recommend bracing for curves between 25 and 40 degrees. And so the scope is real narrow. And I think part of that is most orthopedic centers and hospitals are just not really good at conservative or non-surgical treatment.
So you've developed a very unique corrective approach. Can you walk the listeners through what makes your system different?
I think so. One thing at ScoliCare, we're one of the only, if not the only organization that works together with scoliosis therapists and providers that do the bracing as a team in whole. Sometimes you have people that will do bracing. Sometimes you'll have physical therapists that do scoliosis rehab, but we work as a team in-house. And the other thing is most bracing, like some bracing gets pretty bad results. A lot of bracing works by trying to squeeze and hold the spine almost like a cast. But the bracing we use, called the Scoli brace, developed by Dr. Jeb McAviney, actually works differently, where the Scoli brace will actually put the spine in an opposite position. And because we can put the spine in the opposite position, we can get much better results. Because the research shows that the likelihood of a brace, like a predictor if a brace can be effective at slowing the curve or potentially correcting the curve, is how much change you can get with the curve with the brace on. And because our braces are designed different, we can get much better change with the brace on, so we can get a much better change long term. So we just approach it a lot different. We're actually trying to correct the curve versus just trying to slow it down and hold it there like a cast.
So what kinds of results have you seen? Like how much correction is actually possible?
Well, there's a few things that determine how much correction is possible. One, the size of the curve and how much growth. So if we can get a curve when it's smaller at the beginning of growth phases, you can usually get much better correction than someone that, let's say you get a 17-year-old boy that's almost done growing. So it depends on when we catch them. The earlier, the better the outcomes. Also, as I mentioned earlier, the bones actually grow misshaped, and the more deformity that's developed, the harder it is to change. So every case is a little bit different, but we've seen some cases that reduce anywhere from 50 to 75% of the curves. I mean, every now and then you'll get one that gets down to almost nothing, but the majority of cases you can get pretty good correction. If we get someone that has a much larger curve and they're about done growing, you're not going to see as much change. And so the goals change. So that's part of it. You got to really be able to evaluate each patient and then give them a really good prognosis of what's possible based on kind of what they're dealing with. So everyone's a little bit different.
So what symptoms should people not ignore when it comes to scoliosis?
When symptoms, like a lot of times, like kids and adolescents, they may not even have any pain. If they do, it's actually pretty mild. Sometimes parents don't think that their kid needs treatment because they're not in pain, but it's not really about pain. Pain a lot of times comes more on an adult. So if you think about a growing adolescent, teenager, or even a child, because they develop it, you want to look for asymmetries in their body. Some simple ones you want to look for is, do you see one shoulder higher than the other? If their shoulders are uneven, that means they could have a scoliosis in their mid back. And if you look at their waist, you may see some asymmetries in the waist. One side could be flat and one side could be more indented. If they bend over, you may see like humping in their rib cage or their waist. You may see a shoulder blade sticking out more on one side, or you may notice their pants seems unlevel, like their belt line could be unlevel. But biggest thing is you're looking for any asymmetries. Does one side look different than the other? And if you see that, then it's like, you probably want to get an x-ray because that's how you really tell if there's scoliosis there.
So how does managing an adult scoliosis differ from managing a teen or a adolescent?
The goals in adults are different. And really what you're doing with adults is you're trying to change the natural history of where the curves will go on their own if there's no treatment. A lot of older adults, you're trying to decrease pain, stop the curve progression, and really trying to improve overall quality of life. If you have a younger adult that's more flexible, although you can't change the part of the bone that's deformed, a lot of times their posture has changed and they're kind of collapsing into the curve and improve that. But in adults, the real goal is to decrease pain, to stop or slow progression, and to really improve their quality of life. And so you're trying to help them, you're trying to prevent, like, where would this go if they had no treatment? So you're kind of changing the natural history of the curve progression.
And then you do hear out there that you could correct a spine fully in, is it kids under 12? Is that true?
Well, when you get younger kids, you think of like a child, we would call it a juvenile, like anywhere from 3 to 10. They're kind of like Gumby. They're really flexible and it's a lot easier to reduce their curves, but their curves can come back more aggressively. If we catch someone before 12, generally like early on in the growth spurts, even teenagers, those are usually the curves that are more correctable. But what's also interesting, it's kind of like all conditions that there's different levels of aggressiveness. And so someone that curves that develops when they were younger, they also have a higher risk of progressing to surgeries. Some curves are still more aggressive, but generally speaking, yeah, the younger someone is, the more flexible they are, the smaller the curves are. Those are the ones where you have the best chance of reducing the curve.
So say you correct it on a child, right? Does that maybe develop down the road, say when they get in their 20s? Like say you saw a kid in their, as 6-year-old, 9-year-old, and you corrected it. Now, do you see that does come back maybe sometimes later in life? And if it does, do you do preventative care for that so it doesn't happen?
That's actually a really good question. And kind of how we approach this has changed. If we used to get a child in, and let's say they were 6, 7, 8 years old, and we knew they were going to have a long treatment program, we used to only give them a brace part time because we're trying to prevent brace fatigue. But we've kind of changed that now, where if we have someone young, we like to brace full time and get the curve down really small because we know a lot of times then we can just take a break from wearing a brace. And then we know when they go through their growth spurts, there's a good chance we may have to start bracing again. But every now and then we get cases where the curve stays small and we don't need to do anything. The big thing is the size of the curve when they're done growing is a high predictor of if they'll need ongoing treatment. If a curve is over 30 degrees, then they have an increased chance of their curve progressing as an adult. If it's over 50, it's pretty much 100% going to progress. So when they're growing, the goal is to get the curve as small as we can because that decreases the chance that they will need treatment or that it'll get worse as an adult. But there's other things that can influence it too, but there's things we can kind of predict. So that kind of sets the goals of treatment as an adolescent. And what's interesting, that's what's different between us and the hospital. The hospital just looks at, can we stop it from them having surgery while they're a teenager? We're thinking about how should we approach the treatment so they can have the best outcome even when they're done growing and as an adult.
That's awesome. That's awesome. So for parents listening out there or adults who might have scoliosis themselves, what are the top 3 things they should know?
Well, here's the first thing. If you're a parent and your child has scoliosis, first of all, don't assume the pediatrician is the expert on this. They get missed all the time. Some are pretty good at picking it up, but they only have a bare minimal knowledge in scoliosis, like a lot of conditions. Their job is to, if something is there, refer to a specialist. So just keep in mind that that's kind of, as a primary care physician, they know just a little bit and they may or may not catch it. So don't rely on them to catch it too. The other thing, if you go to orthopedic center, realize the advice or recommendations you're going to get there are probably going to be, I can pretty much guarantee, going to be different than if you go to a private clinic like ScoliCare. And what I mean by that, if your child has, if you go to an orthopedic center, you may be told to do nothing. You may be told to just watch and wait. You're probably told, you can't reduce these. But the only thing they're thinking about is, do we need to do surgery or not? And the bracing they do, they're not really that effective anyway. If you go to someone that runs a private center like ScoliCare, we are definitely more aggressive at being conservative because the treatments that we do are different and we can make better outcomes when someone's growing. And the goal long term is different. We're also thinking about not only during their growing years, but how could this affect them when they're done growing and as an adult? If you're an adult, most of the time it's either surgery. If you're going traditional medicine, surgery, you can get injections in the joint, pain meds. There's not a lot of treatment. Maybe you're referred for general physical therapy, which is not real effective at treating scoliosis. You have to find like someone that truly specializes in that. Our number one referral source is adults or surgeons that specialize in adult scoliosis surgery, because they have no one else they can refer them to. And they know that the best surgeons always try to avoid surgery because they know as someone gets older, a lot of times the outcomes are not great, especially like in a senior citizen. And if the goal of surgery is the same as non-surgical treatment, you always want to exhaust non-surgical treatment options too. So that's what I'd be aware of is you may get different opinions. You have to really do your research and become educated, because sometimes the so-called specialists aren't really up to date on the best non-surgical treatments.
So you talked about bracing a lot. Is there any other effective treatments that you use or utilize?
Yeah, the two main ones are bracing and then scoliosis-specific physical therapy or rehab. And we do a technique called ScoliBounce. And how scoliosis-specific physical therapy is different than traditional physical therapy is we actually teach the patient how to put their spine in a correct position or as correctable as possible. And then you go about strengthening and stabilizing them in the correct position. And then you teach them how to put their spine in a correct position while they're doing their normal everyday activities. So it's completely different than just traditional physical therapy. And in some cases, that's all we recommend is just doing scoliosis specific physical therapy, especially smaller curves or curves that have a smaller risk of progressing. Or if someone just like absolutely doesn't want to wear a brace. If someone doesn't want to wear a brace, we're not going to do a brace. We're going to do treatments they're actually going to do. But if someone's wearing a brace, we're always doing the scoliosis rehab with it.
So how can scoliosis or poor posture impact someone's health?
It really depends on a couple of things. If you think about scoliosis, the thing that we get asked a lot is, can this affect like their breathing? And really, smaller curves don't generally have any impact. But if a curve gets severe, maybe at 60, but typically around 70 to 80 degrees, those large curves, that's when they can start causing pulmonary potential cardiac problems. So severe scoliosis, just from like an organ function thing, those are the ones that can affect breathing and things like that. If you think about posture, though, that is a whole different thing, because when you think about posture, if you think about when someone starts to get hunched over, we would call that hyperkyphosis. There is an insane amount of research and literature showing how that can really affect someone's life. We actually call it health-related quality of life. On a big picture level, we know if you're hunched over, that increases the risk of all causes mortality. Meaning, if you're hunched over, you are not as likely to live as long as someone that's not. One study shows that someone that's hunched over as hyperkyphosis has a 2.4 increased likelihood of having a cardiovascular event. So, and we also know when you look at people when they're older, people that are hunched over compared to those that are not, that's the number one predictor of someone's likelihood of losing their independence. And so what that means is if you're hunched over, you are likely not going to be able to live on your own as long, take care of yourself as long, do the things you want to be able to do as long compared to someone that's not hunched over. We know that drives both loss of quality of life, and it's a predictor that you probably won't live as long.
So, Doc, can you share two powerful success stories? Maybe like your tougher cases, something that sticks out, but two success stories with the audience?
I have one right now. I just thought of, because I saw the patient this week, was a lady whose husband's actually a medical doctor. But anyway, she had what's called a cavernous hemangioma after a surgery. So anyway, this hemangioma caused a lot of neurological problems and basically made her paralyzed. She was a normal adult. She had a surgery, which caused the problem, which led to a bunch of neurological problems, and she's paralyzed. And what happens to people a lot of times when they have severe neurological problems, they start to collapse because they can't hold themselves up. So she is in a wheelchair full time, but even in the wheelchair, she's collapsing over, her head starting to hang over, and they're just looking for options. They can make some modifications to custom wheelchairs, and they get so-so results. But she came to me, and I knew it was a tough case. And she wanted to know if I could make a brace that would allow her to sit and do stuff at her computer at home. But the thing she really wanted to know is she wants to do this trip to Florida. And she wants to know if I can make a brace that can sit and hold her up in a wheelchair that's not customized. And we did. We just had her 1 month evaluation. We had to do a bunch of computer scans of her wheelchair, like the one that she wanted to use it in. She had to bring it in just for that. And like she's wearing it, and she's going later this month. She's flying down to Florida, like on a vacation, something she didn't think she'd ever be able to do again. She'll be able to use her brace to keep her upright. But we had to do a bunch of modifications to it. But for her, it like changed her whole life. I mean, you could just imagine that that's one of your parents and they want to retire, they want to do things, and they're just collapsing and being hunched over. And we were able to make her a brace that allows her to function at a high level in her chair and at home, and completely changed her ongoing quality of life. And that was one at first I was like, I didn't know what we were going to be able to do, but I'm working with the ScoliCare team. We were able to make it work for her, and like she's super happy and she's doing great.
That's amazing.
And another case that's a child. I mean, you could just imagine that that's your child. I remember coming out of my office and I had a new patient, and I see this little girl in a wheelchair, and I see her family, and they just flown in from Illinois. Well, it was a patient that had developed basically a chronic inflammatory polyneuropathy, something maybe you've seen in your practice with neuropathy patients. And her story was she was a normal girl and just child. At 8 years old, she started tripping and falling. And then the parents noticed she's starting to lose function in one of her legs, and she's starting to develop a bump in her spine. So after 2 years of going through Children's Hospital, they found that she has this autoimmune condition that's causing the neuropathy. Well, her spine was collapsing pretty severe. And so a chiropractor that knew of me in Illinois referred her out. And we're able to make a brace that holds her upright and keeps her from collapsing. And the reason we're doing that is we need to take pressure off the nerves to allow her nerves in her leg to start to heal. And we did get a report from her neurologist. And she's not just seeing me, she's also seeing a chiropractor that specializes in neurology and neuropathy, just like yourself. But she's also being evaluated by the neurologist at the hospital, and she is starting to regain the function of her peripheral nerves, along with the work that they're doing and the work that we're doing. And that's one of those, when you ask me why I do it, I just think if that was my kid and I see their life starting to go down and they can't do the things they want to be able to do. If my child ever had a health condition, I would hope there's someone out there that could offer some help. But that was one that they come in and you're not really sure how it's going to go, but you see them starting to improve, and it kind of reminds you why you're doing it.
That's awesome. That's amazing. I mean, thank you for sharing those stories with us. Well, what an absolute powerful conversation that we've had here with Dr. Chris. Thank you again for sharing your expertise and shedding light on a condition that affects millions, but is also often misunderstood. So your work really gives families real hope and real solutions. So thank you again for joining us today on the Healing Wellness Show. Any last words that you want to share with us, Doc?
Well, first, I really appreciate you guys having me on the show. And I guess, if you or someone in your family has a curves, keep in mind, all big curves start off as small curves. And so my motto is to always stay ahead of that curve.
Thank you for sharing your knowledge and expertise with us today. So to our listeners, if today's episode impacted you, inspired you, or taught you something new, please take a moment to subscribe, leave a review, and share this episode with someone who needs it. Your support helps us reach more people who are struggling with pain, inflammation, scoliosis, neuropathy, chronic conditions, and many, many more. So for more episodes on the Healing Wellness Show, visit healingwellnessshow.com and follow us on social media for daily health tips, behind the scene content, and special guest updates. Thank you again for listening. Stay strong, stay well, and as always, keep healing.